I wanted to, a second, my slide have to go forward. Why doesn't it go forward? There. Mitch just reviewed some of these, but I wanted to just say, I mean, sometimes I layer this, you know, here's this and that, but this is very clearly, I'm connecting the dots between voting and our health, and in this conversation today, and why it's a role that we have in public health to promote inclusive voting. And so I will be sure to talk about that and talk about what we can do to advance health equity. So the first, my thing goes there. So I like to start with just what is our mission in public health. I find this a very energizing mission, and I revisit it continually because there's aspects of it that we just don't always fully embrace. But public health is what we do collectively to assure the conditions in which all people can be healthy. I find this a reminder that our work can't be done just by ourselves in our offices or through a specific program, but we have to be in a relationship, working collectively to be sure everyone has the opportunity to be healthy. The other aspect of this mission statement, which I think we often miss, is this concept of assuring the conditions for all people to be healthy. Sometimes we're just happy that we are helping people be healthy, but the assurance is a much higher standard to hold ourselves to. It means that we have a responsibility to look at what creates health and be sure to name it, and then work collectively with others to make it happen. We've all been talking and about the social determinants of health for quite a long time. And we think about them like education and housing and economics and you know, all those conditions. But the part of the definition I want to bring your attention to is that these conditions are beyond the control of the individual, and they're actually formed by the distribution of money, power, social policies, and politics at every level, not just federal legislation or something. It happens from our organization to our local community, to the state, to national, global. Those determinants are being determined. And in fact, rather than think about them like a descriptive noun or something, they're actually, our health is socially determined. That means that we're collectively creating health conditions through policies that are choosing health winners and health losers. So when we understand that and we go back to our mission, it becomes clear that it's critical that we center health equity in our work. Health equity means achieving the conditions in which all people have the opportunity to reach their health potential. That's the highest level of health possible for that person without limits imposed by structural inequities. And just a note, it's not, health equity isn't a feature of persons, but it is a feature of systems. So how do we center health equity? Or why? I should start with why. When we improve the health of the people experiencing the greatest health inequities, it actually results in improved health for all. And wherever we have great inequities in health outcomes, no one is as healthy as they can be. Achieving health equity requires valuing everyone. And there's a second point here, which is with focused and ongoing efforts that address the conditions, the injustices, the systemic processes that are creating those inequities. And there's a concept or a framework talking about targeted universalism, which is where you say we want everyone, for example, to be able to vote. And then you look at at what are the targeted processes that are needed to achieve those goals based on how different groups are situated within the structure or culture and across geographies. Rather than just say, oh, everybody can vote. And some people don't have the transportation, or some people have young children and can't get there, or they don't have the they have a disability, or they just have a risk factor for being in a group because of COVID. So those are differences. And rather than just say it's all equal for everyone, you start to say, in order for people who have disability or language issues, this is how we're going to make it happen. And that's really how targeted universalism works. So what's at stake if we don't lead with equity? First, we're minimizing our understanding of the impact of structural, historical inequities and the trauma associated. If we aren't leading with it, we're also increasing inequities and decreasing our overall health. We're creating barriers to doing targeted investments or approaches. We decrease the power of the communities that are most impacted, and we decrease, back to that idea of our collective power, we decrease our collective power to advance health equity through meaningful change. We're overrepresenting the interests of those who are already thriving. We basically create opportunities, communities of opportunity, and we create through our policies communities that have less opportunity. And where we have communities of opportunity, we see the health status is better. And where it is less communities, where the communities have poor opportunities, we have worse health status. And we see this pattern over and over and over in our communities, our states. And the point of this is that we created these. We created them through policies. It didn't just happen. And so as public health people, we have a responsibility to actually address these differences. It brings us to the discussion of the political determinants of health. Recently, a term and framework introduced by Daniel Dawes. The description is the set of activities associated with making decisions in groups or other forms of power relationships between individuals, such as the distribution of resources or status. So it's not that just we have social determinants of health. The set of power relationships that create those determinants are really maybe better described as political determinants of health. And I like this quote: health is a political choice, and politics is a continuous struggle for power among competing interests. The other thought here from this quote is that it doesn't just go one way. Like it isn't just always move forward with progress to be healthier. Sometimes we take some significant steps back, but anytime we take significant steps back, we can also take significant steps forward. So it's not something that's ever over. How much I might wish that was the case. It isn't. We have to stay engaged and continually participate in this decision-making processes. So it brings me to the definition of power. Lots of people, myself included, we're not ever trained to discuss building our collective power intentionally. We actually sometimes have a negative perception of even the word power, and that politics and power, it sounds like that's separate from our scientific approach to objective good policy. But in fact, power, this quote from Martin Luther King, power properly understood is the ability to achieve purpose. It's the strength required to bring about the social, political, or economic change. It's not just desirable, but in this case, it's necessary to implement demands of love and justice. and I would say advancing health equity. So this one image helped me refocus my own work. We talk about our health and we work on health outcomes and we try to improve health outcomes, and we screen people and we do all the things that we do. And then we began to say, oh, but it's also connected to living conditions. But it took us a longer time to begin to talk about, so we also have responsibility for intentionally building an aspect to our practice that is focused on building the capacity to act, to influence those living conditions. And that's one of our overall responsibilities. So thinking about all that, we came together, a coalition of 11 national public health organizations came together to create Healthy Democracy, Healthy People. When I think one of the things that's important and one of the ways to address our tension about being intentional about building power is being transparent about the beliefs, your aims, your values when we're in this process. So these are the beliefs for our coalition. They are: our health and the health of our democracy are deeply connected. Inclusive, robust democratic processes are vital to creating the opportunity for everyone to be healthy. To advance health and racial equity, it's necessary to assure full participation in the electoral system. All people are deserving of dignity, respect, and social inclusion, which is affirmed by access to voting. And voting is an important way to promote health in our communities. When people vote, they exercise their voice on decisions that have a big impact on their health and the health of their family and neighbors. So this set of beliefs also reflects our values, is actually part of our response to the question all the time that comes up, is like, isn't promoting voting a partisan thing? And it actually, what we know from our data and our vision and mission of promoting good health for all, this is how these beliefs came about, and our response to that. So to build power, community organizers use 3 practices. And we have incorporated base our work in Healthy Democracy, Healthy People on these 3 practices. 1, we organize people and organizations. 2, we organize policy and resources. And 3, we organize narrative and research. And these 3 practices can help change the patterns in our field and in systems, and build collective power. So when we're organizing people and organizations, we've come together as a coalition that represents hundreds of thousands of public health leaders who then are embedded and serve the whole nation. We're bridging connections between public health and civic engagement groups, which is really one of our other themes in the last 10 to 15 years, is how do we act using health in all policies, and how do we strengthen our cross-sector relationships? And we're supporting and organizing communities to create their own healthy futures. So that's like one of the practices that helps align our work. When I talk about organizing policies and resources, we're working to take actions to implement policies and resource investments and system changes at every level in order to ensure access to the ballot for all. And organizing narrative and research is one of the special things that I think public health can bring to this work. We lift up the connection between voting participation in health through research and policy statements in order to build public and understanding and political will to promote health through inclusive access to the ballot and civic participation. By bringing the public health data and the understanding that we're healthier when we're more inclusive, we are moving a transformative narrative to support the policies that will help make that happen. So this is the group of partners that came together. We initially came together in 2020 as Vote Safe Public Health in order to be sure that people went ahead and were voting in during the COVID pandemic, or the beginning of the COVID pandemic. And we recognized that there were barriers, but we were careful when we came together to not just be the people talking about hand washing and masks, but to talk about the importance of voting. So we did intentional work around narrative and our values, and that served as the basis for our transformation into the Healthy Democracy, Healthy People coalition. So the aims of the coalition are to advance health and racial equity by assuring access to the ballot for all eligible voters, increasing public understanding of the connection between civic participation and health outcomes in order to build public and political will and defend and broaden voting rights, and advance inclusive voter policy by creating a new framework and narrative lens, and strengthening the collective capacity of us in public health to actually show up. So I think we have at least, I don't know, there's numbers range, but I know at least 300,000 people in the public health field. And were we to be speaking and showing up as partners with people promoting inclusive voting with our data and with our narrative, that would have a big impact. And when you include our other partners who are organizing healthcare providers and systems, that's 12% of the whole US workforce. And for us to begin to talk, sort of sing from the same page about what's at stake and what's important, will have a significant impact. So when we talk about inclusive voting policies, I wanted to just give a quick primer on this. These are the policies that strengthen civic and voter participation, and they're necessary to advance health and racial equity. And the policies that expand access include things like no excuse mail voting, early voting, inclusive voter registration programs. So for example, many places have automatic voter registration or voter registration offered during their driver's license renewals. And so that's a great thing. And where else should we be offering automatic voter registration? Do you think it's a different population who might be able to benefit if we did it with Medicaid programs, for example? But all of those are good. Anytime we can make it easier to register. Online voting registration and same-day voter registration are also important. And then enabling voter registration and education in service settings is another thing. So when there's points of contact with in a WIC clinic or a SNAP clinic or in our workplaces, that there is information on how you register and how you can the deadlines for voting and early voting and all of that. And another area of great interest is reinstatement of voting rights for people who have been incarcerated at some point or had a criminal record, but have, they've finished their sentence. And reinstatement of those voting rights is a powerful way of re-including people in society. I'll give you a quick overview of what's been happening in the electoral system. So one of the things is that this isn't a new, the tension we're having around elections is not new. This has been since the beginning of our country, where there's been people fighting for being more included and people fighting to keep them from being included. And that, goes to the inclusion of African Americans and people of color, to women, then to the civil rights. So all of that, I mean, that's a long and good story to study, but I'm just going to talk about the last 20 years or so, even 10 years or so. Just since 2010, there's been a set of things happening that are changing our electoral landscape. So in 2010, we had Citizens United, a court decision that basically made it possible for concentrated money to move into the electoral system, where it made it possible for political action committees and super PACs and dark money that didn't have to be reported to move in and begin to influence our electoral system. And then by 2013, we had the Shelby-Holder decision, which struck down the pre-clearance formula of the Voting Rights Act. So where there had been historical injustices around voting opportunities, they used to have to be cleared before they could implement new laws. As soon as Shelby-Holder was passed, by 2018, 24 states had passed legislation making it harder to vote. And 1,688 polling place closures occurred that would have been covered under the Voting Rights Act had that not been struck down. So you can see things are getting that's an assault on our electoral system. So then 2020 comes and we have the COVID pandemic, and I was in Wisconsin at the time when we were trying to figure out, could we even hold a primary or an election in April of 2020, and going to court, and nobody could all the people who had been working in elections, like all those volunteers, when you go, if you actually vote in person, are we're at high risk for exposure to COVID. Many of them were older, and so that was the circumstances, and in that pandemic, in the lead up, 30 states enacted changes to expand absentee voting and make it easier to vote, more promotion. Lots of just promoted the rules that were already on the books about timelines and mail-in voting, and they expanded early voting, and they made it possible to drop your poll, your voting off at a drop box, and have drive-through voting for people who were at risk or ill. And all of those changes created, they were very effective at promoting inclusive voting, and it resulted in unprecedented voter turnout. And there are likely other reasons for unprecedented voter turnout, but approximately 159 million people voted. That was the highest than it's been over 100 years in terms of turnout rate. It was 66.8% across the full political spectrum. That wasn't just one group over another. And that turnout increase was especially large among groups that had historically voted at lower rates. So there was significant increase in youth turnout, turnout across all racial and ethnic groups, and those were really significant. That was over 100 million people voted early, either by mail or in person. And these were enabled by the states promoting mail-in voting options that were available and or expanding them. And the other thing that happened was we recruited a whole new generation of election workers, younger people, and helped recruit a lot of people. And even with all that success, over 33% of eligible people did not vote. And the top reason that they gave for not voting was that they weren't registered. So that brings me back to what happened after I don't know on your screen if we're in the wrong place there. So after 2020, 34 states have considered hundreds of bills to limit access to the ballot box. And many states are considering expansive laws. So as I pointed out earlier, these systems and policies are continually contested. But the on the court docket for October is another case that could make it difficult to challenge voting laws based on racial discrimination. So this contest continues, and that's why it's so important that we participate. Okay, don't know if, let's see, it's there. So as public health people, we have a set of tools. What are our tools? We can use research, data, health assessments, and planning processes. Health assessments or tools like Healthy People 2030 that lays out our national goals. We as a coalition went to the administration and said we would like to see voting metrics restored to Healthy People 2030. It used to be there in 2020, it disappeared. And so we just recently found that they just recently agreed to add Healthy People 20 voting metrics in as a research objective, and our goal is to keep moving it as a targeted core objective. But then, in our roles, we do a lot of reports, white papers, we have bully pulpit, testimony, op-eds. We can build relationships across partnerships and with our elected officials and community partners. When we have direct care that we're providing, that's another opportunity. We can organize and add components into our grant making and resource allocation, basically, and promoting policies at every level. And I like to just point out that just asking questions about what's happening is really helpful. So we can promote policies and resources at every level. This is within our practice and professional organizations. Having a policy in our professional organization allows our professional organization to sign on to a letter asking the Biden administration to include voting metrics, for example. That was one of our examples. But it also provides the basis for us to normalize this as our work. These professional associations, AMA, SOFI, and APHA are all either have adopted or in the process of adopting policy statements, and our coalition partners we're providing assistance to them to do that. But you can do them, we're working with both state and affiliate organizations, national and affiliate organizations. Local and state governments can pass policies promoting civic and voter participation. And at the federal level, we can pass policies that promote inclusive voting participation. And also infrastructure. There's differences in how local elections are funded that range from $2 per capita to $20 per capita. So overall, looking at that infrastructure support and what's necessary, and that's a sort of a federal, or could be a state or federal or local effort. So when I talked about organizing narrative and research, one of the things that happened was after the election, first, I wish we could have spent more time celebrating the wonderful turnout and what made it possible, and how, and having that be the story of 2020. But when I talked about those organizing principles, they get applied across the whole political spectrum. Us showing up to say that inclusive voting is good for our health is not something unique. There are people showing up with a different narrative that are leading to policies that restrict voting opportunities. So that's kind of the invitation into the struggle, be it what it is. So the understanding of the fact that health and democracy are interdependent, our overall narrative that we knew we needed to be able to strengthen in our public spaces, were that higher voter participation leads to the power to influence policy and better health. And where we have the opposite, this circle can go both directions. So that in 2021, in January, we said, we look at this data and we look at it internationally, and we can see this is true, and we believe it's true, but we don't know it about the United States. So we came together to look and create the Health and Democracy Index. And so I would encourage you to go to this website after after or whenever you want, and look at the index, and it's quite interactive. But we compare 12 public health indicators, both individual and community level indicators, to voter turnout and the restrictiveness of voting policies in each state. And states with more voting access and greater civic participation have better health outcomes. Communities that vote are more engaged and can influence policy decisions and have a big influence on their health. The 12 public health measures include these on the right: the individual self-rated health and mental health, adults receiving disability, premature mortality, infant mortality, chronic disease prevalence, active physicians per capita, uninsured rate, and overall health rankings on America's health. And we also included additional social determinants, poverty, community and family safety, and income inequality. These are commonly used to evaluate our health internationally and or nationally in our states when we're doing our state health assessments and community health assessments. We only used an indicator if there was evidence between the link between the indicator and civic engagement, and if it was available in all the states that we were looking at. Is that the next? So just be sure that that was the right slide. Yeah, so where's my, what we discovered was this pattern. Isn't this cool? The pattern was very clear. You can't, when you go on the site yourself, you can see wherever the policies were more inclusive, the health was better, and where policies were less inclusive, the health was worse. And we had and I missed a slide that talked about the tool. The tool we used was the cost of voting index, and so maybe it's coming up, but basically when you go onto the site, you can find your state and click on a health metric, and also click on the laws that are in place and that could be in place. And you can sort by state, you can sort and look at everybody's infant mortality by state, so all these things are interactive on the site. The key findings were that states with more inclusive voting policies and greater levels of participation are healthier. And states that make up elections, that make them more accessible through policies like automatic voter registration and all the things that I mentioned earlier, enjoy higher levels of voter participation, greater social cohesion, and stronger public health outcomes. And lower voter participation drives health disparities. So those were the primary findings, and it was really pretty amazing how clear the patterns were. Now I'm going to try and go back and see if I can find here it is, the cost of voting index. So I wanted to just say what was in. So we looked at those health indicators, and then we also looked at this cost of voting index, which is a political science data analysis, statistical analysis, and they look at the cost of voting refers to the time and effort associated with casting a ballot. And they've been keeping this data since 1996, and they can, the people who do this research were able to rate states from easiest to vote to hardest to vote. And we had Oregon as number 1 for easiest and Texas as number 50 for the hardest. But the elements include voter registration, voting from home, voter ID, restoration of voting rights, hours of polling, and early voting options. So that's the analysis that we did in comparison to the public health data points that we described, these points. And then this is the the pattern that we were able to see. And New Jersey is right up here in the middle of this room for improvement and pretty good on a lot of things. So what can we do? We can adopt policies and position statements within our own organizations. We start with our own work settings and professional organizations. Those are, they help create the norming and the opportunity and the conversation to share the beliefs and the values and the data. We can conduct and share research on health and voting, both the what's already done and help develop case studies at a local level, promote inclusive voting and voter registration policies, support restoration of voting rights. We can serve as election workers and then support workplace policies that also encourage election work. We can incorporate voter education into everyday practice using tools such as the Healthy Voting Guide, which is a tool we've developed that tells you the voting opportunities, like all the rules for every state and all across the country. And register to vote regularly, encourage family and friends and colleagues to vote, engage with elected officials about issues that matter between election cycles. So voting isn't enough, you then show up with your friends and colleagues to say this matters to us. And remember to vote like our health depends on it, because really it does. Here's this Healthy Voting Guide. It's a nonpartisan, health-oriented guide to aid voters to learn about their options. It includes the contact information for all the local offices, and it makes it easy to share in a clinical setting or in a work setting, anywhere that you have contact with the public or colleagues. And you can join up with us by connecting to the Healthy Democracy, Healthy People initiative, and you can just reach out with your thoughts and ideas there. But I recognize that some of you may be in work settings or working in occupational health. There's a civic alliance, employers civic alliance, that is also working in these areas. And if you're in a healthcare delivery system, Vote ER is another partner who has developed badges for people when they're talking to patients that they can just scan and things like that. So there's a number of groups across the sectors working to advance health and inclusive voting. And just the point that every generation leaves behind a legacy, and we'd like ours to be a healthier, more inclusive society. I am going to quit sharing and hope that you have lots of questions.
Thank you, Jeanne. That was really wonderful. And thank you for all that great information. We do have a couple of questions. And for those of you that are still thinking about your questions, please put them in the chat box, in the Q&A, not the chat box, in the Q&A, and we will get to them. So one of the questions was about how do you get high school seniors and doing registration with high school seniors?
Well, that's great. Well, it could be a part of the graduation, or even it could be part of the civic class, could be part of the school's initiative. It's just a decision that you make as a person in that system, that we're going to pass a policy or we're going to make this possible. There are student voting organizing groups. Students, and they're one of our partners, and now I'm trying to remember their name. Sorry, Student SL something. I'll figure it out and I'll remember to send it. Who are doing that? They're working also on college campuses, and we're working with the Association of Schools of Public Health and and programs of public health to promote that relationship. It'd be nice when people come to college that to the university right away if in that welcome packet is, I don't know, are you changing your address? If you are, here's how you register. If you're not, here's how you absentee, that kind of information. But I think that incorporating into civics classes, not that many people even take civics classes, but there's all sorts of things that people do when they are graduating. You know, they have to fill out this paper and that paper, and you know, you still have to sign up for selective service when you turn 18, and you know, those are great spots to catch young people and get them engaged. There's a cool some cool data that came out that shows that when young people vote, they actually have better mental health or self-reported mental health, and better, are doing better economically, something like 5 or 10 years later. So Circle is a group at Tufts that does a lot of youth evaluation and is a great resource too, and has a lot of youth data on voting.
Great, thanks. So many of the people participating today work at local health departments. You know, how can they be involved in the process without violating any of their, you know, the issues of working at a public agency?
Yeah, again, the narrative and the story, the data, sharing it, and being able to tell the, you know, say, hey, look, where it's more inclusive, we're going to be healthier. And actually, you know, you can't go being against a particular, I mean, you know, we're a 501c3 too. We're not saying this is the particular law number 52 or whatever that you should be adopting, but being in an educational role, which we often are, and connecting the dots is something that we can do. We are working with NACCHO is one of our partners, and they helped create the healthy voting guides, and they distributed them in 2020 through their various, through the whole network. And we had spokespeople from NACCHO speaking to the media about how important it was to vote and how to engage in the elections. And Big Cities Health Coalition is also a partner. And we're working with a handful of cities who are encouraging their mayors, or their mayors are encouraging increasing the opportunities to vote by putting things on their website for how to register, and, you know, for all their city services. And we're encouraging public health people to show up in that space to add that oomph that comes from understanding that we'll be healthier, more resilient communities if we are promoting inclusion.
Great, thank you. Here's a question. For many years, the state of New Jersey has decreased the public health budget and funding of local health departments. We've had increasing mandates without funding. Currently, the public health funding is supported through grants, which utilize the existing resources. So how do we get our legislators to hear us and understand that our funding should not require grant funding? And then how do we get our legislators to put health questions in the voting booth to influence the inclusion for local communities to have a voice?
That's great. I love that we're thinking about that. First thing is, for years, I've been in spaces where people say, how do we get everybody to care about public health and give money to public health and pay public health development of public health infrastructure? And, you know, we even had a 10-year initiative about renaming ourselves. You know, the problem was that we called ourselves public health and nobody knew what it was. Now the problem is we call ourselves public health and people all have an opinion about what that is. But I think that the first step is deepening our relationships with people who are working to advance issues in our that will improve health for people experiencing inequities. And when we show up as partners and allies with our data, with the narrative, and demonstrate and be in deeper relationship. I mean, not only, I mean, the communities that had built stronger relationships with community groups are also, could lean on those and depend on those relationships during the distribution of vaccines and COVID tests and messaging and having trusted messengers. So I think relationships is number one. I think that's probably the biggest thing. Whenever we go off to say, give us money, nobody cares about that. And so it's the issues. The second part of that question, which was how do we get them to put health issues on the ballot, is an interesting question. The idea of direct ballot questions is, one that's been kind of emerging, and we saw an impact on that in Kansas, and we saw, what state is it, Michigan, who's tried to put it on the ballot, something on the ballot, and it's coming off. And but when we had when Minnesota tried to pass a law to make it harder or make it not possible for gay people to be married, public health, our commissioner of health wrote op-eds saying this is a health issue. Here's the data. This is a health issue. This is important to promote good family health. So even though somebody might say, oh, that isn't an issue for us, it was an issue. And the commissioner recognized that and spoke into that space. And that's what we're doing here with voting laws, saying, no, these are actually health issues. So I don't know if that completely answered that question. It was one that made me want to hang out with you, whoever asked it, and strategize.
Well, we'll connect you with Rochelle. So yeah. So another question is public health funding. A lot of it comes down onto local taxpayers. And so the incomes of the communities that are served and poor communities can't afford to support municipal health departments as well as affluent communities. So how do we change this?
Again, it's showing up at the, like you can't change it from your office in the county or the city. You've got to have demand coming from the people. And those people have to be represented and have to show up and vote. And so, and that's probably when you connect the dots about why are people healthier in the places that they vote, where the voting is better. It's because they're influencing and have, when you go out and you're crowdsourcing, what do people care about? What makes them healthier? They know that having a job, having a good education, having transportation, not having the smoke shop, they know this stuff. We don't have to go explaining it all. But when they're not represented, it makes it hard to make those policies happen. And even, and it's a constant process. So that's why we've just decided that this is pretty important to connect the dots on this issue, because they flow, the rest of these things flow. And when you look at those laws or those court cases and stuff that I talked about in the electoral landscape, even full voting is still going to be, it's still going to be difficult to reclaim representation when there's been dramatic gerrymandering, or, so it's an actual real call to action that goes deeper, like get out, be sure that we get it, make it as easy as possible for people to, legally vote and promote that. And then, then we have relationships with people where we can share more of what's needed for early childhood and infant mortality and, the other kinds of things that we have a whole set of evidence-based policies we'd like to be passing. I don't know.
Great, thanks. So I'm not sure about the whole context of this question. One person asks, how is overall health of a community how is overall health of a community measured? And it may be in relationship to the the graph that you showed with the policies and better health and better policies and or more policies in health. Can you talk a little bit about that?
Yeah, the measures that we used are commonly used in state health assessments, and community, county health assessments. When now that the healthcare system, nonprofit healthcare system has to do community health assessments, the data that they look to is often the data that's prioritized by Healthy People 2030. And then, they say, okay, we're going to work to try and improve that. But when you compare country to country and community to community and population to population, infant mortality is one of the most sensitive indicators, and maternal mortality. We have, and then, you've got these consolidated measures that are coming from America's health rankings and county health rankings. There's another R missing there, but the county health rankings, where they are saying, here's the elements that go into a measurement of how healthy your county or your state is. Here's the, so those are how we've typically measured it. The thing that was new for us was to then analyze it compared to the cost of voting index, which is also looking at a set of measures. They were only available at that point at a state level. So that's why the Health and Democracy Index does this state by state. In public health, one of the things that often happens to us is we're like, well, prove it to me, prove it to me. Are you sure it's not this? And are you sure it's not that? And what we're in right now is a period of time where we have to look at what's this pattern and what's the pattern mean? And when you see such a dramatic, clear pattern between countries that require voting and make it easy to vote and just naturally register everyone to vote when they're the right age, and us, that we have less, worse health. And that's an important pattern. And then when we look at it again at a state level, we're seeing that same pattern. When we look at it demographically, which the data wasn't available to compare all 50 states demographically, but when we look at smaller scales, it's obvious there too. So knowing that that's a pattern is one of the places that we start with understanding and looking at those. How do you connect the dots? So Scott Schroffnagel, who is the professor from Northern Illinois University, who developed or is the steward of the cost of voting index, will be publishing an article. I'm always like sharing his thing earlier, but he's publishing an article this fall, because after this analysis, he said, well, everybody says, well, is it so yeah, maybe the people were poor, or maybe this is why. And so he did a control to look at education and income, and the pattern is still there. And one of the other things that was interesting is like, okay, we know this pattern in infant mortality, Black infant mortality and white infant mortality, but where there's more inclusion, the gap is less, it's smaller. So you start to look at all that kind of data and you go, inclusion is good for our health. Representation in a healthy democracy is just good for our health. And I think we can safely assert that as people whose position is that we're supposed to be assuring the conditions that create health.
Yeah, I think that's the answer to the next question. There was someone that asked, what do we say to people who say they don't intend to vote?
Yeah, a lot of people, we say we're sad.
Yeah.
I think that part of the issue with sort of what people might call disengagement. I mean, what we discovered is it wasn't that people weren't voting really because they just didn't believe in it. It was most often that they didn't know how to register and that there were barriers. So first of all, there's that. The same with young people. It's not that the young people, when they look at that data and you go to Circle and you look at their data, they are actually pretty engaged around a set of issues, but there's these barriers and things. But there is just think about the benefit to people who are wanting to obtain and consolidate power to create cynicism in a set of people to disengage them from a process where they might assert some power. So to make people have the experience that often happens when in a very gerrymandered district where, well, it doesn't really matter because I've got the person, they either agree with me or don't agree with me, what can I do? It's not just, I mean, the elections happen at every single level. And that gerrymandering also happens, you know, and can be overcome with participation. And the other thing that happens with the voting is that people think, okay, I cared about this person, and we oversell the candidate. You know, it's like, well, if you only elect this president or this person or that, then everything will be all right. And then when it isn't all, it doesn't all happen the way we thought it should have, we're kind of like betrayed. That policy that they cared about, they didn't actually pass it. Without we don't have enough engagement around the need to remain engaged in the process.
Well, great. Thank you so much. I think we'll leave it at there because we were at the hour. Jeanne, this was such a wonderful presentation.